This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hi everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I am not board-certified or Dr. Schmuchter in any way or form. I'm just the sidekick here to help our listeners better understand all these crazy medical doctor terms. So here we go. Who do we have, Al?
well, speaking of medical doctor terms, we have a lot of terms to ask.
Yes.
Our guest today, Dr. Stephen Suter, whom I introduced earlier and talked about his DVM and PhD degree from University of Pennsylvania. Then he went on to get his board certification in internal medicine oncology at UC Davis, and now heads up the canine and feline molecular oncology diagnostics lab.
Wow.
I think I got all that. But
Welcome.
what I'm so interested in is stem cell therapy, bone marrow transplant, apheresis. What is apheresis? Janet, we've got
Lots
a lot
of
of
questions.
questions.
But
So
let's-
welcome, Dr. Suter, and I hope you'll put up with us because this can be trouble, the two of us.
Let me put it this way.
Well,
Our husbands will
I am-
have enough of us and
Yeah.
walk away.
I am a professional educator, so I'm used to it all.
Thank you, God.
So tell us how you got started in all this, like from,
Yes.
not like you were born wherever, like just how'd you get involved?
No, I'd
Yeah.
like to know where he was born.
Okay.
Well, the sun was shining in 1958 in Harrisburg, Pennsylvania.
Praise the Lord.
Yeah, praise the Lord.
Our niece went to Bucknell.
And we're
Oh, yeah.
Clevelanders. We're
Yeah.
native Clevelanders.
Yeah.
we're in
yeah,
Cleveland.
we're up around the same area then. Yeah. Well, I actually kind of fell into this whole transplant apheresis thing kind of backwards, to be honest with you. I didn't really wake up one day and say, well, I want to be a canine bone marrow transplanter, and I want to do apheresis. It really didn't work out that way at all. I had really learned about all this while I was doing my PhD at University of Pennsylvania. So I was part of the dual degree program there and did my vet degree, and then I stayed on for an extra 5 years because I'm a glutton for punishment to do a PhD.
You wanted to get the pennant and the
And,
T-shirt.
Yeah, exactly. Yeah. And so that project was actually for a sort of a gene therapy project to treat dogs with severe combined immunodeficiencies called X-linked SCID. And people get that too. And so you may remember the Boy in the Bubble movie. That was the disease that young man had, unfortunately. And there's 2 dog models for that at Penn at that time. And so my project was to use gene therapy to correct that genetic defect, and that involved bone marrow transplanting puppies, actually. And so that's where I learned about bone marrow transplanting dogs. As part of my project, of course, I had to know the background of bone marrow transplantation in people, because the object of this project was to then go ahead and do it in people using this dog model. And I realized during that research that there was a ton of information in the human literature, not the veterinary literature, on bone marrow transplantation. And all that work, the vast majority of that work, was done at the Fred Hutch Cancer Research Center using dogs as a large animal model for the human disease. And so that's where I was like, holy cow, I can't believe there's all this literature on dogs out there relating to bone marrow transplantation and this funny thing called apheresis. And it was really an eye-opener for me that data was out there, and I had never heard of it. Now, they were using all this in a research setting, certainly not in a clinical setting, but there were a lot of manuscripts published by the group who won a Nobel Prize in medicine and physiology for their work of transplanting client-owned dogs with lymphoma, and I was just like, this is crazy. I've never even heard of it. So that's where I kind of ran into it.
So I'm
Oh
going
my
to be
goodness.
honest. I have had BMAC, bone marrow aspirate concentrate, done.
Yeah.
They took it out of my hip because I had a bad,
Yep.
I think it's my right knee, and they, as I'm putting it in layman terms, spun it around and put it behind my kneecap.
That's right.
And it's pretty amazing. And I
Yeah.
think they're doing that as like Tommy John surgery now too on humans,
Mhm.
right?
Is,
Yep, sure
is
are.
that bone marrow transplant or stem cell?
So that's really it's sort of the same, a bone marrow stem cell. So I transplant bone marrow stem cells for dogs who have had radiation, because the radiation kills the marrow, and then you put that bone marrow in and it goes, woohoo, let's make all the cells we need to stay alive. Janet had used it as sort of almost like a reconstructive procedure, where those stem cells in the marrow go ahead and make the cells that are needed to make a joint slippery, for lack of a better.
Wow.
lack
To
of a better-
lubricate,
Yeah,
so
so
to
there's a-
speak.
Ah.
number of different applications for it.
How does it work if I'm bringing my pet into you who has cancer? What
Well, first of all,
happens?
what type of cancer?
Yeah, what type?
Yeah, so it's really used for lymphoma mainly, because that's the main actually disease that we treat in the medical oncology setting is lymphoma. There's clearly an epidemic of lymphoma among purebred dogs, sadly. And leukemias, acute leukemias, which are really nasty. And then you can use this for some other what are called myelodysplastic syndromes. In other words, syndromes where the bone marrow is not working right. So you can kind of get rid of that old bone marrow and put in new bone marrow.
Does it really work like that?
Yeah, it's it's almost like magic. You know, for us three to sit here every day, our bone marrow has to make 12 trillion cells a day. So that's a tissue that is really active and really dividing. Without that bone marrow working, we wouldn't be here. And so bone marrow is why it's my favorite tissue. It's just cranking out cells from the moment you are born to the moment you die, and it doesn't require a brain.
Right.
It just happens. You know, it's kind of like your heartbeat. It just kind of happens. And so that's all controlled very carefully. But if that control is lost, then you can get leukemias or you can get lymphomas, et cetera, et cetera. So it's quite amazing.
Wow.
So when you put new bone marrow into a person or a dog, those stem cells, they know where to go. They don't go to your nose or your ear, you know. They go to your bone marrow, and once they get in there and get all comfy, they go, okay, you know, let's go. Let's make the cells we need.
So do you
Yeah.
so do you take the bone marrow, say, God forbid, my dog has lymphoma. Do you take her bone marrow cells, or do you transplant from another source that doesn't have
Yeah.
lymphoma?
That's a really good question. And so there's two types of bone marrow transplants. Again, I try not to get too technical, but I have to use some
Sure.
technical terms. There's an autologous transplant where we use the cells from the patient themselves. And so people undergo autologous transplants all the time. Let's say I had lymphoma and I was treated with a chemotherapy protocol and I relapsed with disease.
Right.
At that point, I'm usually so resistant to chemo that I would go for a transplant. And so I would probably do a different transplant called an allo transplant. So auto and allo. Auto is using the patient's own stem cells, or allo is using somebody else's stem cells. So let's make up a terrible story that Alice, you developed acute leukemia.
Okay.
And that disease is not treatable with an auto transplant, your own stem cells, because you can't get a cancer-free product from you with acute leukemia. It's everywhere. It's just terrible. So Janet, if she had submitted a tube of blood to the public blood banks, let's say she would match you. That usually takes about 2 weeks to find out. Then they would take Janet's stem cells out of her, not even using a bone marrow aspirate. This is where apheresis comes in, and use Janet's cells to transplant you, because Janet doesn't have any cancer. So we can harvest cells from Janet that are cancer-free and put them into your bone marrow after some type of major effort, some effort that's going to basically kill your bone marrow. And that would be either radiation or high-dose chemotherapy. Hopefully that either of those would kill all the cancer cells in your body, and then we would use Janet's stem cells to go, okay, let's replenish all those cells that bone marrow can make now. So that's kind of how it works. So autos, we use patients themselves. Allos, we use a donor, and we can do both in dogs, believe it or not. So I've done both for years.
That's so, it's amazing. It's
I
like the
know.
Jetsons. It's amazing.
Like the Jetsons. You know what it almost reminds me of? And again, I'm very simple-minded. It almost reminds me of fecal transplant. Like you have
Yeah.
someone with the disease, someone without it, and you do the fecal transplant, and all of a sudden you've cured that diabetes in that dog, or whatever the species.
Yeah.
Go ahead there.
My wife's a vet, and she loves fecal transplants.
I bet. I think
As
it is
humans, we all go, ooh, right?
Yeah.
Yeah, but Janet,
I
it's
would
in a
do it.
capsule now. It's
Yeah.
in a capsule, like
Yeah.
no biggie.
Yeah.
I was just reading Dr. Suter this morning on one of our, you get those kind of daily news things from Nature magazine.
Yeah.
And a man in Japan that was paralyzed, they took some neural stem cells and gave it to him, and it cured his paralysis. I
Yeah.
think the stem cell thing is really something so cool.
Very powerful. And there's a lot of different sources of stem cells and different types of stem cells. In the transplant setting, we're using what's called a hematopoietic. It's a long term, which is basically a blood stem cell. And we have ways to figure out getting them out of a dog or a person with just this machine. So you wouldn't have to go through what Janet went through. Nobody has to put a needle in your hip.
See?
You can use these machines to actually harvest those stem cells. Then we can count them, and then we can make sure we have enough to go ahead and do a transplant. And again, all that work of the millions of transplants that have been done worldwide in humans was all done in dogs first.
Wow.
So if you talk to Dr. Storb, who's the guy who did almost all of this work, I think he's about 93 now. He says that 95% of all human transplant protocols, 95%, were all perfected in dogs.
See, another thing they do for us.
You're right.
Seriously.
Yeah, exactly.
Now,
Yeah.
how does that differ from when I read about, is it CAR T cells?
Yeah.
Is that
That's
that similar? That's something to do with the antigen on the cell, isn't it?
that's a little bit of a more sophisticated type of
I
transplant.
try to understand that, but it's tough.
Yeah. It is tough. They're genetically modified T cells to attack cancer is really the best way to describe
Okay.
it. But those T cells need to be taken out of a person. We haven't have that technology in dogs yet. And then genetically modified and then put back in via transplant into that person. So it's sort of a transplant, but those cells are modified in a lab.
So how many, I'm assuming veterinary oncologists across the U.S. are doing this? Do you see what I'm saying? Like
two.
Ah!
me and Dr. Ed Sullivan outside of Seattle, Washington, has been transplanting for a long time too. So we were the NC State and his private practice in Seattle were the only two facilities in the world that offered the procedure.
But you see this going bigger and larger and grander, right?
Yeah, I do. It's interesting how hard it's been for me and Ed to get folks to accept this, actually. And so it's really flies against the dogma because we're trained and I was trained, and it's perfectly valid to be trained using palliative chemotherapy to extend life. And so chemotherapy works.
Yeah.
That's all there is to it. In most dogs, especially with high-grade B-cell lymphoma, you can extend their lives for a year to year and a half. And if you have a 10-year-old black lab that comes down with lymphoma, getting it to 11 or 12 and a half, maybe even 13 sometimes, that's not bad for, a lab's life. However, the demographics of this disease, since I was trained back in 2000 and 2002, has changed dramatically over the past 2 decades. And we see lymphoma in young dogs all the time. So the average age of the dogs I've treated here at NC State, and we've treated 157, is 4.
Oh,
Whoa.
So you have a family with a couple kids. They want to see their golden retriever grow up with their children. They come down with lymphoma at 3, 4. That dog's not going to see 6. That's all there is to it. So a lot of these dogs are owned by families who have young dogs and want them to be a member of the family as their kids grow up. I'm just using that as an example.
So how do patients, owners, find out about you? And Dr. Sullivan, what's your name? Ed Sullivan, poor guy.
Yeah, that's all.
I'm married to Don King, so there you go.
I miss the bubbles. Anyway, when we first started, it was usually owners found us themselves because local medical oncologists, their local medical oncologists really didn't know about it. And as we did more and more and people became aware of it, then we started to get referrals from a lot of other universities and then a lot of other high-end specialty hospitals, and that has remained the same. And so now it's about, I'd probably say 50-50.
what is the longest? What is the longest a dog has lived? What's your highest success rate?
Story.
Yeah.
Oh, cured. 8 years.
Oh my
Yeah.
God.
That's the point of it.
Yeah.
The point is cure. Yeah. So
Wow.
that's why it's such a wonderful thing. And that was actually proven in the literature that I talked about that we never read in 1986, which is, that's back in the
Yeah, that's
Stone
old.
Age. You know,
That's when I was in vet
science.
school. Yeah, it was the
Yeah,
Stone Age. You're right.
yeah, exactly. So that's been known for a long time,
Oh my
but we've
gosh.
just never been able to manage to do it in a clinical setting. So I didn't invent really anything. Certainly, I've modified the program through the years, but I just took it from the scientific research setting and plopped it over into the clinical setting and showed that it can be done and it can cure a relatively large population of dogs with
Well, and it
lymphoma.
made
So
a
when
lot of sense to you. You know what I mean? It was
Oh,
logical.
Yeah.
yeah.
I'd like to see what, I mean, this could blow up with humans in a good way.
Well, yeah, I mean, it's definitely could expand. I've spoken, this is why I always like this opportunity to speak to folks like you, because I've spoken all over the country, locally, and internationally, and still a lot of people still don't know about it, and I don't really understand why, because I've published all my papers and all that kind of stuff. So I'm always interested in educating people about this, because it is a very reasonable alternative, not for everybody, but it is a very reasonable alternative to standard palliative chemotherapy. It's an aggressive option, and it's always with the intent to cure.
I love
Would
that
you-
word cure. I mean, that's like almost, that took me back, really did. Explain, Dr. Suter, what is the procedure? So if
Right.
Janet calls you about Libby, her golden, and,
Who's
wants
perfect.
to pursue this, what is the stepwise procedure?
Yeah. So the first thing, all the dogs who come to transplant do have to receive some form of chemotherapy.
Right.
And that's just what's called cytoreduce, to reduce the tumor burden down into the smallest possible number of cells, and that's called clinical remission.
And they stay
So-
with you while they're doing that?
Nope, that's done locally.
Oh, okay.
Yep. So Janet would take her dog to a medical oncologist in wherever she lives, and that medical oncologist would probably institute a chemotherapy protocol. Most people use CHOP, CHOP, which is 4 different drugs, and the goal would be to drive that dog as close to remission as possible. In the meantime, I would say to Janet, you need to get on the horn and find as many siblings and or the bitch and the sire
Oh, problem.
as soon as you can. Yeah, as soon as you can, and submit a tube of blood, just a simple tube of blood. Out, we would help with this. Send it out to the Fred Hutch and see if we could find a match. Right? Because we know clearly that the allo transplants using donor cells, the cure rate's about double
Oh,
as in
yeah.
auto. So we'd always do say, you need to do it right now. You got to get on the horn and get going. But it can take a while to find those dogs and also get the matching sequences back.
So
If we find a match,
could I put Libby's blood in that bank?
we don't have a bank. That's the problem. We have to match dogs a la carte,
I
for lack of a
see.
better word.
Yes,
Yeah.
that's a
Yeah.
good one.
Yeah, we don't have a bank like in people. Yeah.
I see a need for
So
a
anyway-
nonprofit blood bank.
Yeah, well, we've talked about that a lot. So then, if there was a match, then we'd say, okay, we're ready to go, and we would get
Libby.
organized to bring both dogs to. Back when I was doing it here, to NC State,
Okay.
where we would then give the donor dog a medicine under skin called Neupogen, which is benign. It drives their white blood cell count really high, and then we would hook them up to an apheresis machine for about 4 hours to harvest those stem cells out of their blood. And that machine is just like a dialysis machine. It takes out what we want and puts everything back. It's just a machine. And then we take that product and we go, okay, good, now we have those stem cells. And now we would give your dog total body radiation, and that's the whole dog, to try to make space in the bone marrow and kill those cancer cells. And then we'd use the donor dog cells put right back into your dog right after the radiation.
And is that just
to
an
go ahead.
IV?
Yeah, it's just an IV. It's like magic. Yeah, and then the dog stays in the hospital for usually about 2 weeks. Their white blood cell counts go very low because we have to wait for that new bone marrow to go. Okay, let's go, and that takes a while. And then once that new bone marrow kicks in, then they can go home.
So is
That's like a miracle.
it's amazing, but
It is.
but is the dog? I'm assuming is I don't want to say put to sleep is asleep during most of this procedure, and then the 2 weeks that they're there,
Yeah.
they're kind of up and about, but quarantined. I would
That's
assume.
right. Yeah, that's a part of it. They're usually quarantined depending on which transplant they do, an auto or an allo, anywhere from 2 to 5 days.
You know,
So does the owner sleep on a cot in that room, or don't you let them?
We've transplanted so many dogs from all over the country that just depends on the owners. A lot of people will stay in a hotel here for a couple
Yeah.
of weeks and work from home. Some people, I've had people drive from California and drop them off and drive home and then
my
come back in
God.
3 weeks. So you think about any type of owner every option is a possibility. We had one dog, Millie from California, who donor dog lived in England. And so they brought the dog from England with her owner over, and they stayed at a hotel right down the road here. And when we were done with that dog from England, the donor, he went back to England, and then we dealt with Millie, who was cured, by the way. So there's all these different ways of doing it. It can be a little bit complicated.
Okay, I'm seeing a whole business opportunity. Like you can
Janet,
put in.
I'm seeing a B&B.
Me
You and I
too.
can open a B&B. We'll tell Dr. Breitschwert, we'll open right next door to him
Yeah.
on his farm. And
Yeah.
we can house these people.
And a blood bank.
Yeah.
Oh, they
Yeah,
have the
they can
human.
help.
They have the bone marrow. That whole thing. Totally.
Yeah.
But here's the
They
issue.
can help Dr. Bryceberg take care of his cows.
I know.
I wonder if
I know.
I wonder if we
No
could find-
cats, though. He wants no cats.
I
Yeah,
wonder
no
if we could
cats.
find any matches because Libby's, escaped, God forbid, a puppy.
Well, no,
mess.
see, that's the
Yeah.
problem, Dr. Suter. I've got two Goldens right here. Both are rescues.
Yeah.
One's from China
Yeah.
rescue, and the other one's Amish rescue. Janet's got an Amish rescue that escaped. So, Janet, you and I have,
We're
I don't know
screwed.
how we would,
Yeah.
yeah.
In that case, if you wouldn't find a match, then we would backtrack to an auto transplant, right? And so we would do an auto at that point, because still, the cure rate of that for a dog with B-cell lymphoma is between 30 and 40%.
Okay, it's still pretty high,
So
yeah.
so we'd always start with that's why I say we start with an allo first, and then backtrack to an auto if we can't find any match donors.
Wow.
Yeah.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
I have a very important question, though, Dr. Suter. On your website, I'm looking at all of the adorable pets that your staff owns. Where is your pet? Not in the picture.
No, my pet is not in the picture.
What do
Yeah.
you have?
We
It's Amish. He doesn't want his picture.
It's in the dog protection plan. program.
well, I'm from Harrisburg, Pennsylvania, so I know a lot about the
Yeah, I
Amish,
bet
that's
you
for
do.
sure.
Yeah.
Do you have any pets?
Yeah. Oh, I have a lot of pets. We just had a little bit of a rough spring 2 years ago and lost 4 pets in about 6 months. They were all
Oh,
old.
but
And
still.
so we just finished up our rebuilding phase.
Oh, yeah.
That's why I don't see.
Now, wait a minute. Let me ask you this, Dr. Suter, because we're probably around the same age, and these two are the
No,
first.
he's closer to my age. He was
Okay,
born in
but anyway,
58.
listen to this, Janet. These two are the first two young ones we've had, because I usually adopt
Yeah.
the old ones.
She's
This has
exhausted.
been a
Yeah.
challenge. Let me tell you right
Yeah.
now. Old people
Yeah.
should not have young dogs.
Pretty tough. Yeah.
But they're
We adopted a white boxer puppy about a year and a half ago, and I forgot what a pain in the what.
Yeah, yeah.
oh my gosh.
She's sweet. Yeah, so we have two dogs, 2 cats, and 5 chickens.
Oh, pet chickens.
Yeah, pet chickens. Yeah.
We're going to do a chicken show, by the way. But
Oh,
we
good.
did one on avian, but the next one's on pet chickens. Yeah.
Yeah, I love them. They're
I know.
great.
I love chickens.
Okay, what are the chickens'
Yeah,
names?
they've
I gotta ask.
Okay, well, we have 5. So Sneaky's the oldest. Then we have Junebug, Olivia, Britney Spears, because she's a little bitchy. You can
She
cut
keeps
that
taking
out.
her clothes
And,
off.
yeah. She dances a lot. And Sally.
Oh.
Our friend has,
They
she
really-
has scarlet
I don't-
because the thing is like red in the face.
Yeah.
And then I
Yeah.
met somebody else
Yeah.
that has over easy, scrambled, hard boiled.
Oh.
I thought it was
Oh, that's good.
hysterical.
Yeah.
Like-
I can't say that I don't care about the price of
Yeah.
eggs.
Yeah, I bet.
Are there ever any, I mean, sadly, are there any patients that you have to turn away?
Oh.
Yeah, very few, but there have been some that I was worried that the process itself, which does stress the system,
Yeah.
it's lethal radiation,
Yes.
and so it can stress the system. And so if we have dogs who have a lot of kind of weird comorbidities, like really bad heart
Yeah.
disease or really bad endocrine diseases that we're worried about them. Seems like dogs who have really bad skin issues for you,
Yeah.
Alice, those dogs seem to really struggle a lot, so we really worry about
Yeah.
those dogs. So there are some dogs we have turned away, not many. Probably the worst one was a dog from England who, sometimes you just never
They
know
came
what
all
you're
the
gonna
way
get.
over.
Yeah, and That poor dog was just in a bad way. It
Oh,
was
I'm
a dog
sorry.
that I just felt very uncomfortable treating, and it was a long, hard conversation over 3 days, quite frankly, and we decided that we wouldn't do it. So I do turn some away because I don't want to cause more harm than good, quite
Sure,
honestly.
sure.
So there have been a few, and it's never easy for sure.
Will pet insurance cover?
Yes, so that's huge.
Janet,
Yeah.
we've got to push viewers to get pet insurance from day one.
I
Yeah,
agree.
anybody that has a purebred dog that doesn't have pet insurance, sorry, Janet, is crazy. You
Yeah,
should
I
get
don't
pet
I don't
insurance
have
for
it, and I
sure.
really should. I really should,
Yeah.
because I went
So
through
it
it
took me
already.
about, I don't know, maybe took me 3 or 4 years to convince Trupanion back when I started this in 2008 that it was not experimental.
Oh.
And so I just had to send them my manuscripts and talk to them about the clinical service that I was running, et cetera. So, and they finally decided to cover it. And then all the other major ones kind of fell in line after that. So it's covered by most major pet insurance companies, which is enormous.
Wow.
Now, is your
That's a
work,
godsend.
that is your work covered by the college, by the university?
I'm not sure I know what that means.
So
You're not with the university, are you?
is your
I'm still with the university,
okay.
yep.
so the institute
What do you mean,
itself-
Janet? Grants and things?
Yeah, like where are you? How are you supporting CTAC?
I'm not. CTAC is completely separate.
Oh, okay.
Yeah, it's my little side. It's my side
Side
gig.
gig, yeah.
It's your business. That's great.
So we're no longer transplanting dogs at NC State, which is why I started CTAC.
I see.
Yeah.
Oh,
Very
boy.
smart.
Yeah.
I have a question about multiple myeloma. Do you do anything for that?
For which
Multiple
one?
myeloma?
That's a great question too. So we've talked about that many times. Multiple myeloma is actually the number one disease that people get.
And
for
I've had
transplant.
friends that passed away from that, which is why I wanted to ask
Yeah.
you.
Yeah, so I've never transplanted dogs with myeloma. We've talked about it a lot. It tends in dogs to be a little bit more of an indolent disease that's really easily managed with prednisone and this particular chemotherapy called melphalan.
Yes.
And those dogs can live years. Now, they can have a blast crisis after many years on chemotherapy. But it's an older age dog disease, 8 to 10 or 11. And again, if you can get 2 or 3 years more of good quality of life with those pets, it sort of makes it hard for me to think about transplanting those dogs.
I hear you.
For the price it is. So I never have. We've certainly talked about a variety of diseases like that we thought, well, I wonder if that would be better than just that chemotherapy alone. But we don't have the database to prove that yet. And it's pretty hard for me to recommend that over standard.
Sure.
Maybe if it was a 5-year-old dog that had some type of weird variant that was acting more aggressive than usual, I might consider it. But in the sort of the standard typical dog myeloma, it's kind of hard to
Do
recommend
you
that.
see a difference in the dog after that 2 weeks? Like because the cells are regenerating, do you see like a little bit more vim and vigor? Do you see what I'm saying? Like,
Yeah, it's amazing the transformation we actually see in the hospital. So they get pretty punky because their white blood cell counts go
they're
to
like,
zero.
"Hi," yeah.
Yeah, and then all of a sudden, once they kick in, I mean, the bone marrow just goes boom, and they're like, "Let's go!" And they start eating again and running around. But they can look pretty punky there for a while, no doubt about it.
That's awesome.
The kind of weird thing is as their neutrophils go up, which are these cells that fight infection, their platelets go down. So they get really active from having all these neutrophils, but we don't want them jumping around too much because the platelet count's really down. So we're like, slow down a little bit. Yeah. So it's quite interesting to watch for sure.
What about the lymphoma I see, epitheliotropic lymphoma? Anything with that? Because nothing works, I can tell you. Lomustine, it doesn't.
Okay, put that in layman terms, please.
That's skin lymphoma.
Okay.
Lymphoma confined, and a lot of golden retrievers get it, Janet.
Oh,
Sure do. Yeah, that and another weird disease called histiocytic sarcoma.
Yes.
Another one in the skin. We've talked about that many times too, and we still haven't done a dog on that with those diseases. But I think it might be helpful for those diseases because they're very aggressive. So,
Horrible.
Chemotherapy and radiation kill rapidly dividing cells, and so those cells are rapidly dividing. The question is, how long would it take to build up that database to prove that was the tough part. So the short answer is not yet, but I'd love to.
Yeah, me too. Because whenever I would get those biopsy results, but of course I kind of knew when I saw it clinically, there's no good. Lomustine, we used to use Tegasin, the old etretinate,
Etretinate.
and of course steroid, but it just, you can't predict it. Some of them live 2 weeks, some of them live 2 months. It was horrible.
And one of my least favorite diseases for sure.
Yeah.
Yeah. The other one is, boxers get a ton of gastrointestinal lymphoma.
Oh, I know.
Which happens to be T cell, which is really bad. And so we've always wondered if a transplant would help those dogs too. So there's a wide variety of weird, what are called round cell tumors for Janet that we wonder about all the time.
Blue Buffalo natural veterinary diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo natural veterinary diets.
So, Dr. Suter, if one of our listeners is interested in coming to you for treatment, what do they do?
Well, they just have to pop onto our website at CTAC, and we have a whole portal there for owners and veterinarians, and there you go. Yep, so we would just get that ball rolling right there. Either a veterinarian can put in a referral, or we can talk to the owner, or we can do both. And then we first start a conversation. That we are very transparent. I have always been very transparent about what I do, and owners and veterinarians need to understand the pros and cons. As I said, it's not for everybody. Right. And maybe not for every patient. So it's really a pretty good in-depth conversation about everything that we're talking about right now, quite frankly, to make sure that everybody's on the same page before we start going down this road. Because once you start going down that road, it's sort of hard to stop, because it's really just 5 sequential steps. And people spend a lot of time and a lot of money to get here. We've transplanted dogs from Saskatoon, Canada, California, Vancouver, all over the place. So it's a big deal that I don't want them to start down that road until they really understand exactly what's involved.
It sounds like
Have
it's
you
very
ever had to
personalized.
turn anyone away because of the owner? And I don't mean financial.
And
I
give
just
us
mean
names.
because-
Just kidding.
Because they're the ones we don't want them staying at the B&B, Janet.
Yeah.
Yeah.
If you said to
We're
turn
going to have
them-
to screen people out.
I know.
Yeah, you have to screen. Yeah, they take a personality test. So these folks are obviously incredibly dedicated.
Yes.
They're spending tens
And
of thousands
emotional.
of dollars on it.
Oh,
and
yeah.
they're very emotional. So it's a lot of psychology involved, a lot of talking. I don't think I've ever turned away somebody based on the owner. I have had an owner or two not want to come to us and go to Dr. Sullivan's practice,
Okay.
Which is fine.
Yeah,
I don't
yeah.
care. I just want their
Right.
dog to
That's
be treated.
right.
But most people are, if you are very honest with them and let them know these are sort of the rules, like you can't visit during that 3 weeks due to pet safety. As long as they understand the settings, as long as you set those expectations, most people are pretty good about it.
Oh, thank God.
Okay, so we have a
But it's
question for you. What makes you passionate about what you do?
Oh, I know the answer.
Ah.
I do too, but
Yeah.
I'm asking.
Curing dogs with
Yeah.
lymphoma.
C-U-R-E, cure.
Yeah.
Has to be.
Okay, and our
I've never, in all my training, I've never heard that word, And for years in private practice, or not, years in fighting this disease, I've never been able to say that word. And now I can say it relatively confidently, which is really nice.
Oh, I love it.
So what is your pet or human peeve?
Ooh.
Pet or human peeve? You really want to know what my human peeve
Yeah.
is?
People that eat chicken.
Bring it on.
No. Can you cut this out?
Yeah.
Yeah,
When you
sure.
edit it?
Sure.
It's people who put their dogs in baby carriages.
I love that. I actually bought a baby carriage and gave it to an
Oh.
owner.
Oh, Alice, what are you
Well,
doing?
let me tell you why, Dr. Suter. Because this little Shih Tzu, first of all, is an elderly woman, and this little Shih Tzu was like 13 and had been on prednisone for a year, had so much muscle atrophy. And I had bought this thing at the thrift store, and I gave it to her because she lived in Minnesota, and I'm in Florida right now. And she couldn't have been helped. And I said, and when you get home, what are you going to do? You're going to talk to your veterinarian. We're going to get this dog off of that cortisone.
Prednisone or cortisone?
Yeah,
Same thing.
Okay.
same thing. Yeah. I don't know, it just
Well, they're
gets
all
me.
over New York City, those prams.
But see,
I
I get
know.
so excited when I see a carriage coming toward me or stroller, and it's not an infant.
Yeah,
When
yeah,
it's
yeah.
a dog, I'm like, ooh.
I think they should train
I
the
guess-
dogs to do this, like the Queen's
Yeah.
way.
I guess I would maybe just back off that a little bit. If a dog's really ill, obviously
right,
I
right.
understand that you have to get the dog. But a normal dog in a baby carriage just drives me insane.
I think a
Yeah.
chicken in there would be fun.
That's even better. That's even better. Once you get a leash for my chickens, that'd be kind
A
of fun.
hen in the hen
Another
house.
business for us, Janet.
Yeah.
We could have those strollers at the bed and breakfast.
That's right.
Yeah.
And we'll use
Yeah,
the eggs for the breakfast.
That's
we
what I'm
got
saying.
it all lined up.
It's going to be vegetarian breakfast.
But
They
we
can
could
have
use
the
the
fake
eggs.
bacon, but they get the real eggs.
Now I know why you guys invited me to this talk, because you're trying to build some businesses up with my ideas.
No, listen, I'm too tired to do a business. Janet,
I'm the
You already
business
have one.
person. She's the
Janet has
veterinarian.
all the energy of the family. I don't.
Yeah, you're done. Yeah.
So what is, your wife is a veterinarian?
She is. She's a general practitioner right down the road
That's
here.
awesome.
Not
Yeah.
retired.
Nope, she's 15 years younger than
Oh,
me.
okay.
So
He's a
got a
cougar.
ways to go. Yeah.
Did you
yeah.
meet in vet school? No.
So
Well,
I met
possibly.
her when I was a resident at Davis, a medical oncology resident, and she was a fourth year student.
Oh, see, Janet,
Oh.
Dr. Stewart is
I
like
know.
that we interviewed from my class, who now is married to Randy Stewart. And
Yeah.
we used to say
Wait,
to
is
them,
that the
get a
horse
room.
doctor? There's a horse doctor.
Yes.
That's the one. Okay.
Well, I claim innocence because she went out with my roommate first, and I just kind of ran into her one day, and I knew that they were never going to work, and then
Hey, Alice,
I just circled.
Alice's husband, she tried to fix up with a friend, and my mom was like, "What the hell is wrong with you? Like, why are you fixing
Yeah,
up with
I
somebody?"
didn't. No. So wait, Dr. Suter, what is your friend doing now? That was dating
We're
your
not
wife?
friends anymore.
He's on faculty. I think he's still on faculty at UC Davis.
Oh.
He stayed on as a clinical pathologist.
Oh,
Oh,
okay.
Yeah, I think he's still there. Yeah, he's very successful.
wow.
Yeah.
Well, I met my husband on a commuter train, but we were not in the bar car. I just want to make that clear.
Ah.
Till later.
Till later.
Yeah, till
Then I
later.
was on the
Did
bar.
Did you know Rob Schwartzman at Penn? He was the derm
not
guy.
not really ringing a bell, but I haven't been there in a long time.
Yeah, Rob's passed away, but he really started. He was one of the founders of our college. Yeah.
That was he. Yeah, yeah,
Of Ohio State?
Although
yeah.
no, of the Derm College, American
Oh,
College of
oh,
Veterinary Dermatology.
oh.
Although sadly, and I hate to say it, my mentor was one of the founders, and you mention his name to one of the young ones, and they have no clue.
Yeah,
And
no.
and you wouldn't even be a member of this college now without Dr. Breen, Dr. Schwartzman, Danny Scott, all those people.
Yeah.
The history is so important as far as I'm concerned.
Yeah. It's the same in my specialty. Nobody knows all the five huge people. And I was like, who?
Yeah.
I was trained by a guy named Bruce Madewell.
Oh
who's
yes.
really, one of the godfathers of medical oncology. And people have no idea when I mention it who he is.
Did you
Yeah,
know
so-
Guillermo Cotto?
Sure
Yeah.
did quite well.
He's going to be
Yeah.
on the show,
Is he? Good.
Oh,
Yeah,
great.
he's been around a while
but
now.
he's busy with grandchildren, so we have to work around that.
Yeah.
Well, Dr.
Yeah.
Suter, I have to tell you, when I
Yeah.
had the BMAC in my knee, the doctor was like this: "You can't put any weight on that leg for 2 weeks." And I'm like, "Well, why?"
boy.
And that, let me tell you, that's hell, because your legs like cramped
Yeah,
up,
that's
and
hard.
you had crutches and the whole thing. He said, "Picture it like a peanut butter and jelly. If you put pressure on it, that whatever I put in there is going to ooze out." So yeah, and so
Squish
I
out,
was
yeah.
like a nutcase. Like
She is a nutcase.
I am. Well, I follow
Seriously,
direction
she
though.
is a nutcase.
I am in a case, but
About
for
everything.
2 weeks it was hell to not put any weight on
Yeah.
that leg. It was hard. Like, imagine taking a shower. It was really hard, but it
Okay.
worked.
Yeah.
I will tell you how she's a nutcase. Our mother was a nutcase, and sadly, our father had cancer of the appendix. Well, then it went to his colon. Okay, so I was a hospital pharmacist at the time. So I got him an appointment with our gastroenterologist at the hospital, Dr. Kazmersky. So my mother, who Janet takes after,
Okay,
is kind
I
of
didn't say this
Lithuanian and
comment though.
very
I know where
crazy.
she's going.
Like cheekbones up to here and always looks like this crazy. So we go into the exam room, me, my father, and my mother.
I was
and-
not there.
Yes. And my mother says to Dr. Kazmersky, where is all that BM going? Because my dad wasn't pooping. And I just
Yeah.
went, oh my God. And so
Here
Dr.
she-
Kazmersky, who was chewing gum, said, I don't know. So this is the Novotny family.
I never said that. But poor Alice is like the pharmacist at the hospital, this professional. And all of a sudden her
Yeah.
mom is making this crazy nut job
Crazy.
comment. And then
But anyway,
well,
we digress.
We digress. But
Digression is
well,
good.
it has been an absolute pleasure. Thank you for the important work. It's amazing.
I'm still in awe of this. The word cure, I love that. I just love it.
So Alice, you've never even heard of this before, right?
No, I did not.
Yeah.
I mean,
See?
I know about,
See?
about bone marrow. I mean, I've heard of that. And I'll tell you one
Yeah.
other thing, Dr. Suter. I was on a committee for AVMA, Council of Biologics and Therapeutics, and one of our members was developing, I guess, a statement for the AVMA to make about stem cell. And I got to tell you, they racked that person over the coals. He couldn't say anything right. And it was very sad because he had so many good ideas, but they were just kind of hedging on it.
They were
and I'm not
nervous.
sure
Yeah.
what they're. I know they did come out with a statement. I was on the CBD statement one, so But when he would present this, I thought, what are you people afraid of? This is cutting edge therapy. People need to know about this.
Yeah, you're sort of echoing what I've gone through with transplant, to be honest with you. So people just seem, number one, I know we probably have to go, is
No.
these dogs have a lethal disease. These dogs have a lethal disease.
Yes.
They're going to die. Period. I mean, unless they're ungodly lucky, which the cure rate with chemo is probably below 2% or so, they're going to die. And so why would you not try something kind of novel? It's not even novel anymore. I've been doing it since 2008.
Well, especially since
why
all
would you not
the
consider it?
research is there.
Yeah.
Yeah, it's all there. But in veterinary medicine, we weren't taught that research, and people are busy. Nobody really takes the time to stop and look at it, and it's been really hard to let people know that this is actually a viable alternative. It's been really frustrating
Yeah,
sometimes.
so funny.
I think it's incredible.
Because
I
when
really
my
do.
orthopedist said to me, he goes, "You don't have a lot there. It's like you're bone on bone." He goes, "Are you willing to
Yeah.
try this?" And I was like, "Is it going to hurt me?" And the most pain I had was the hip bone. That was
Yeah, from
uncomfortable.
when they did
Nothing
that.
that Advil wouldn't
Yeah.
cure, but it was like sore for a while. But I was like,
Yeah.
"Wait, if it's not going to hurt me, why not try it?" So
Tolerance.
there you go. Well, thank you. It has been a pleasure. Thanks for taking
this
the
has been
time.
wonderful. It's such a pleasure meeting you and hearing about all this. Janet, we've got to get pet insurance.
I got to get pet insurance.
Yes.
I'm going to get
We
it
did a
for
whole
me.
episode
Janet.
on pet insurance. We got to talk to that
Janet.
person.
Janet, you need pet insurance.
She's
Yeah, we
4.
did.
She's going to be 4.
And you know what she said, Dr. Suter, the number one thing is if, for example, if the golden that's laying right here, if she is itching, maybe because she has a flea bite, okay, and it gets coded as itching, then they won't cover allergy. You see what I mean?
Yeah.
So it's all in how you code it at
It's
the
like
beginning, because it can
humans.
set you for life then.
It's like
Yeah.
humans, though. Every time you call and they recode something and put it through insurance, they
Yeah.
pay it.
Except I will tell you, Dr. Suter, I remember having a case of epitheliotropic lymphoma, and I had to fill out the insurance papers. They didn't have that as a code. And so it got kicked back. They weren't going to cover it. I had to call there and say, who is writing these codes? Skin lymphoma is a common disease that we see in this breed. So sometimes they just don't know.
Well, I can tell you that I see very few mutts in my practice. I deal with only pets with cancer, and I don't see probably 98% of the cases that I see are purebreds.
Yeah, see?
Yeah, so that's what I'm saying. Get
Get insurance,
because
yeah.
nobody thinks their dog is going to get their purebred's going to get cancer, but a lot of
I
them
don't
do.
even
Wow,
consider
what-
they'd be like a purebred, even though she is, because she was from a puppy mill. You know what I mean?
Even the designer breeds now, golden doodles and stuff, they're still purebred. And anything with mini in front of it is even worse than a purebred. So don't get anything with a mini.
No.
Oh, wow.
And I'll tell you, I was walking the beach this morning, listened to a webinar on intervertebral disc disease in
Yeah,
the French bulldog. It's a disaster.
it
At
is.
2 years of age, the discs
Yeah.
are just disintegrated.
Yeah.
Wow.
Horrible.
Guess what my last puppy was? I got 4 months ago.
Oh no.
No.
I love them so much, but I got a French bulldog, English bulldog. mix,
Okay, well
like
that's
the two-
good though.
Cute.
The two worst ones ever. My God, I love that dog.
Oh.
They're adorable.
Oh.
He's awesome. He's really beefy because he has the English bulldog part of him too. So he's quite the athletic little guy.
What color is he?
He's kind of brown and tan. He's just a damn cool
Oh,
dog.
Email Alice a picture because we'll put it up on the screen.
Yeah, we loved it. People love to see other people's pets. I'm telling you,
I'll
it's like
I'll tell you what.
voyeuristic.
I'm such a proud papa. I don't even show people pictures of my kids
No.
anymore. Can you see it?
Oh my
Oh, look
God.
like a baby.
That
Oh.
belly. I want that belly.
That
wanna,
is
like-
so cute. I know.
I'm telling you what. He's just the cutest thing I've ever seen.
Oh my God. Oh, is
Okay, well, wait a
that
minute.
cute.
I just spent 2 days with this gem.
Yeah.
Pretty cute. Now we got
Oh
the
my
pictures
God.
going now.
But that
Wait,
great
here's this one.
here's
Here's
this-
Annie.
Annie.
This is the Amish breeding dog that was probably too
that right?
too small to produce a lot of puppies.
And where did you get her from?
Well, I help out Golden Treasures Golden Retriever Rescue in Akron, Ohio. And then the
Okay.
China one, we took some of the China dogs too. That's Gidget, but she can't jump. She's full figured. Listen, I predict the legs on that dog are going to become vestigial because he's always picking it up and holding it.
Yeah. Well, the sad part is my best friend is a veterinary neurologist.
Oh, who's that?
Chris Mariani. He works at NC State. Anyway, he's like, "What the hell have you done?"
The ophthalmologist is going to get you next, and the dermatologist is going to get you next.
I need the ophthalmologist.
I don't care.
I know you don't care.
I don't care. I love him.
This has been such a pleasure. Thank you for everything you do and making us aware of something that can actually cure a horrendous, deadly disease. That means everything right there.
We love that.
I'm glad that you guys are open to hearing about it. For
Oh,
sure.
my gosh.
It's quite amazing.
Well,
So
thank
anyway,
you.
Janet, this is Dr. Alice Novotny-Jeroman and
Janet Novotny King, Cleveland native, saying thank you for listening. Don't forget to like us, love us, share us, and extra biscuits for your pets. Thanks for joining us. Bye.
bye-bye, everybody.
Bye, everybody.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.